So, people ask me, is NCR performed by traditional doctors? And then, what is the difference between NCR and what kind of treatment I get from my doctor when I go to him or her? Well, first off, yes, I have trained a few medical doctors to do NCR, and so it is done rarely, but it is done in the medical community. But there's a big difference between the kind of medicine techniques represented by NCR and the kind of therapies represented in mainstream, traditional medicine. When I was a medical student, I went back and looked up the dictionary in Dorland's medical dictionary to see what the definition of naturopathic medicine was. And it said that it was the pursuit of medicine that is designed to treat the cause of conditions, not the symptoms. And that was attractive to me because I was chronically ill growing up, and they only treated my symptoms. When I had bronchitis, as I had for 4 to 6 months every winter, when it got bad, they would give me antibiotics, and that would lessen my chest congestion. And when I had a cough, they would give me cough medications. Or when it got really bad, the cough medications would be codeine instead, and I would be kind of loaded on codeine for days. But they never figured out why I was getting sick. So they weren't using naturopathic medicine at that point. Now, when I fell and broke my arm, and we took x-rays, found out that it was broken, and then put on a cast, that was naturopathic medicine. The cause of my arm pain was the broken bone in there, and setting the bone so that it would heal was treating the cause. That was the actual problem. When I had bronchitis and they gave me cough medicine, that was not treating the cause, that was treating the symptom. So that same medical dictionary said that medicine was either allopathic, treating the symptoms, or naturopathic, treating the cause. So similarly, NCR is not a symptom-specific treatment. So if someone comes in and said, I only want the NCR to make my sinus headache go away, I actually can't choose to only do that. What I have to do in NCR is to keep optimizing the physical structure to where the sinuses drain and the sinus headache is no longer created. So I can't just treat the sinus or the jaw or the neck or the back or the headache on a given day. I start kind of like I was a sculptor chipping away at a big rock with a statue somewhere found in the middle. I start chipping away, optimizing the overall structure until the symptoms cease to be elicited. With a mainstream doctor, if you are depressed, he or she will tend to give you a medicine that will make you feel less depressed. And when you stop taking that medicine, your condition will not have been changed. That makes it allopathic. With NCR, we will also treat you to make the depression go away, but by the time we've changed your skull structure enough that your brain performance has improved, the changes that you'll have in your brain function will be long-lasting. And that's the difference between NCR and mainstream medicine.